list basic legal and ethical issues for health-related professionals. Can Mr. Emmanuel mute his microphone, please? Is it Emma?
Mr.
Who is that?
Imadodu, Mr. Imanododu,
Mr.
please, I
Meboji,
plead with
please, your
you to.
microphone, we beg you.
Oh, Jesus.
Mr. Ima and Mr. Meboji, please, your microphone.
Oh. Mr. Dodu,
Yes, madam.
please kindly mute your mic.
Okay, okay, I'm
Thank you
trying
so much. We
to.
have less time, left. Mr.
I'm
Mevoji,
trying.
please kindly mute your mic.
I've already done that, please.
Thank you.
Okay, so we'll be able to list basic legal and ethical issues of for health-related professional related for health-related professionals. Describe how medical documents is compiled. Continue. Next, the language of medicine. You will be able to identify dates, the time when people had only spoken language and no written language. So the medical terminology dates back to a time when people had only spoken language and no written language. Continue. Medical terminology gained uniformity as a result of the works of Hippocrates mainly. The Hippocratic Code, many of you might have heard of, forms the basic ethical standard of modern medicine with regards to obtaining. Can you mute your microphone?
Yes, please.
Mrs. Dudu?
Yes, please, a moment.
Mm. All right, so I've given this slide in the chat. So everybody, please make sure you find it. If you're able to multitask on your device, find it for yourself as well. Okay? So yes, so the Hippocratic Oath forms the basic ethical standards of modern medicine with regards to obtaining from voluntary acts of mischief and corruption, keeping confidence and doing no harm. Some aspects are still debated today as it relates to abortion and euthanasia. If there are any questions, please, I'm going to invite you to feel free to ask your questions. I think with our class being this large, if we go into extensive discussion, we may never go through everything. So we'll have to devise a strategy for us to participate fulsome, to get fulsome participation and to get through the lectures. I will have to vary how I normally do the lectures this time around. So as we progress, we will continue talking about how we will invite participation, okay? So derivation of medical terminology, the study of the origin of words is called etymology. And please practice speaking, okay? Many medical terms used today are based on ancient Greek, Latin, and I have another presentation which I will go into a little more of the history. So word building became and remains the primary way to describe new medical discoveries. Derivation of medical terminology. Word knowledge was primarily passed on through only verbal communication, which resulted in words being pronounced differently. So, depending on which background it is coming from, it sounds different. The word heart is derived from Old English heart, which comes from the word related to the Greek cardia, which so heart and cardia is referring to the heart at the same time, depending on where it came from. So pluralizing the rules, they would add s to words ending in any vowel or consonant except s, x, z, or y. And the example here is joint, or and joints is the plural. That you would add es to words ending in s, x, or z with example of reflex or reflexes. Then pluralizing terms, rules continued. You would remove x and add ces to Latin words ending in x, with the example of appendix and the appendices. You'd also remove the y and add ies to words ending in y, preceded by a consonant like example mastectomy or mastectomies. Pluralizing terms continues when an ending y is preceded by a vowel. The usual plural suffix is s, like boy to boys. Add e to Latin term ending in e, in a, like lamina or lamine. You'd also remove us and add I to Latin words ending in os, like bacillus or bacilli. Would change SIS to SCS in Greek. Words ending in SIX, psychosis, psychosis. We have pluralizing term continuing, remove on or on from and add a, which is the example of criterion, criteria. You would also remove from and add a to Latin words ending in like diverticulum or diverticula. Okay, so you have the Latin and Greek meaning, Greek rules. So for singular, you have fossa, the plural, fossae, datum, data, radix, radices, and Greek singular plural, neurosis, and neurosis. The is becomes es, ganglion to ganglia, calyx. The x changes to es. Spelling and pronunciation of medical terminologies. Misspelling and mispronunciation in a medical setting can result in life-threatening situation where the patient was to have a colectomy, not a colectomy. So one is that these are two different terms. So I want you all to, you can multitask on your devices. So someone look for CHOL, they sound the same, CHOLECTOMY, and one look for COLECTOMY. So look up the two words and tell me what they mean. Two different parts of the body, though it sounds the same. Any volunteers who is looking?
Okay, I just me.
Dr. Donette, come again with your Dr. Donette, come again.
I need two volunteers to look up the meaning of the two words on the screen. Both of them are colectomy, but they're two different words.
Okay, collect me of the H. That's O O N is to remove all or parts of the colon. That's the large intestine to treat conditions like cancer, Crohn's disease, things like that. For the colon.
So which one of the words, which one you just look for, CHO or CO?
No, no, no. With O Lectomy.
COL, right?
COL.
Right. So that's referring to the colon. Now somebody look for CHOL.
So the CHOL, I'm having the meaning here as surgical removal of gallbladder.
Oh.
That's right. So imagine you went to the hospital and two persons were talking. Two medical practitioners were talking. Say a nurse goes to hand over a patient at the patient intake door at the operating theater and says one thing, and another, the person who received the patient interprets something else. And a different person who did the investigation is doing the surgery from the one who saw the patient before. They interpret two different things. The patient goes to surgery and comes back out from surgery, and you find out that the patient's problem was not resolved, but the patient did have surgery. So yeah, there can be confusion if there is not clarity. All right, so spelling and pronunciation of medical terms, continuing. So pronouncing a word out loud each time you see the pronunciation will help to familiarize you with the sound of the word. So reflex or reflex. So is reflex or reflex? Or the pronunciation, that's how it is sound. That's how it sounds. Reflex. Say it. When you see it, practice to say it, because you will end up in settings and you will say something that sounds strange and somebody will say, what is that? Or you may go on TV and be doing an interview, and we've heard it already, and we hear naturopaths say some weird things, and people say, what is wrong with that person? They don't even know the name. I see it is Kadish. Kadish, your hand is raised.
Yes, I did look it up, but based on what I'm using here, my search engine, it's not bringing up CHO as colectomy, but cholecystectomy.
Cholecystectomy. Yes, so
Right.
it can be, yes. So the CHO and the COL refers to two. It's basically just saying you can say a word or say a pronunciation and it can be interpreted differently, which is, in medical science and as a nurse, many times when we are checking some narcotics, one nurse does not do it. It Two nurses will always be in place. That's actually a legal requirement for two nurses to not just check the spelling, but also the dosage and the patient, the time that they're supposed to get, and the kind of medication to eliminate medication errors. Because errors can happen in medical science. And sometimes it's not just language, but sometimes it can be language. So when more than one persons are engaged in the process, then it's the likelihood of errors taking place is greatly reduced. And sometimes, although we're talking about the words now, I will also interject other experiences. And so reading is very important because sometimes people will just look at colors as well. Because in 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 the hospital setting, sometimes you may have two drugs like potassium chloride, which is a potentially lethal injection, maybe in a white and blue bottle. And you may have something like sodium in a white and blue bottle as well. Sodium is the same thing as your body fluid. It's just sodium in water or sodium chloride. But it's easy for someone to just look in the cupboard, see a white and blue because if the sodium is in a white and blue bottle and pull it up, administers it to the patient, only to realize that it's the wrong drug and you could have a dead patient. So, you know, the language and precision is very important in practice. That's just as a side. And anemia, you see how the word anemia is spelled or how it is pronounced. Knee. There is a emphasis on the ne, mia. And do we have anybody here who don't know what anemia is? In my training as a nurse, one of the things we did to concretize our grasp or our mastery of the medical terms, we had a dictionary. There was a pocket-sized dictionary that I kept in my pocket, and that was a requirement. Our pockets were big, and you had your dictionary with you at all times. So whenever you go into the hospital, you have a scissors, you have your stethoscope. You will see doctors with their stethoscope, but a dictionary was also a requirement so that whenever you met a term that you don't know, you make note of it. So I'll encourage you all to start your own glossary. I will share with you a glossary of medical terms, which Prof shared with me last year, but it's not comprehensive. There is so much more, So I will encourage you, and particularly when you are going through these lectures with me, when you see a word that is not familiar to you, start a glossary for yourself. Take a book and write down the word and note the meaning, because that may be one of your questions in your exam. You may see anemia and several meaning options, and then you have to identify what is the meaning. So an exam question can look like that. So you see reflex, note reflex. You see colectomy, note colectomy. You see anemia, note it. It's tempting in our modern times to depend on our telephones, but the patients are watching us. And I heard a patient commenting that she does not want these internet doctors to look after her. These doctors don't know anything these days because they only use the telephone or telephone doctors. So I know nobody on this call will be counted among that lot. And then typhoid, that is how typhoid is pronounced. And you have the long and short vowels that will guide you. Let me just get that money to help you with your pronunciations. Next slide. And the legal and ethical issues. The American Hospital Association's Patients' Bill of Rights gives guidance which provide a clear ethical standard. You want to change to the next slide? For patients' rights. So the patient has several rights. So as we progress, while you're changing, as we progress through this course, we will utilize the medical systems. We'll use the systems to teach you the language And it's not limited to only what you will get, because we want you to learn the language in its context and not just learning a dictionary in isolation. So you go back to legal and ethical terms. Yes. So the American Hospital Association Patient Bill of Rights gives a guideline which provides a clear ethical standard for patients' rights. Patients have these rights, and there are other rights that could be added: right to refuse care, the right to considerate and respectful care, right to privacy, right to be informed. And using medical terminology is instrumental in both verbal and written communication. Documentation of healthcare services must be complete for both ethical and legal reasons. So when you're documenting patients' records, it is easy in medical context to write the first name of the patient. But there are patients that could have the same first name and the same surname. Or you could have three patients on a ward with the same names, same first name, same surname. So then there needs to be other things that distinguish the patients. So the bed number may be one of them, and it is tempting to choose. Don't move on too far. It is tempting to choose the bed number, but the bed number can change also. So the patient's age, the patient's sex, patient's diagnosis. Yeah. So medical terminology is instrumental in both verbal and written communication. So you may say it, but it needs to be written. Documentation of healthcare services must be complete for both ethical and legal reasons. Medical records. The format for medical record depends on the location you are functioning, the jurisdiction in which you are practicing, the coding and billing practices, institution, responsibility.
Mr.
Please
Mevoji,
mute your mic.
Mr.
Mr.
Mevoji,
Mevoji.
hey,
There is a problem here, please. I am faced with a problem. I cannot watch the screen. That was said. That's what I was working on. Sorry for the inconvenience.
So configuration of computer systems. So these are things that influence the format in which medical terms or medical records are kept. And in your training, you will go into the institution,
Mr.
so you
Mevoji,
will
please mute your
interface.
mic.
I'm saying I had a
Donette, I'm
challenge. I'm
sorry.
working on it, please.
There's this noise coming again.
Okay, so using medical terms, you look at the medical records, as I just mentioned.
Oh,
Please, I'm working on
Mr.
it. I had a
Mevoji, why are you
challenge.
doing this to us?
I'm saying I had a challenge. I'm rectifying it. Sorry. It's not my making. I had a challenge.
Whilst rectifying, please just keep quiet. That will help us. You can rectify it, but please just keep quiet for us. Thank you.
Thank you.
Okay, so the patient's date of birth is another distinguishing factor. Patient's age, telephone number, and this question came on the licensure exam, which I sat in end of last year. SOAP. So this is also very prominent in nursing practice. In your final exams, you will be asked. You have a herbal portion, but you also have a biomedical portion. You have a naturopathic portion and a biomedical portion. So you will do anatomy and physiology. You'll be exposed to some laboratory investigation. You will be exposed to nursing. And this is one of the things that is one of the acronyms that's used in nursing. So SOAP, and in some contexts you may see SOAP. So with the E at the end, and the E is for evaluation. So you have the subjective assessment, you have objective assessment. The subjective is what you see, and objective, no, subjective is what the patient tells you that you cannot measure. And objective now is you are able to measure, like the blood pressure, the temperature, right? And somebody else can do it, measure it, and get the same thing. That is objective. And then the assessment is where you do the head-to-toe assessment, and then you have a plan of action. This was on our exam, final exam. So, and you see the example over here with the patients with a tonsillitis problem and chief complaint is sore throat for X amount of days. The subjective is what the patient told you, because you can't measure the patient's sore throat, right? The patient said they had a fever, but you can't tell unless you do the measurement of the temperature. Then it becomes objective for you. And then they had difficulty swallowing. You cannot measure difficulty swallowing. So that's what is referred to as subjective, and you refer to these things as data, subjective or objective data or information. Objective refers to what you are able to, what did I say? How do you access the objective data? You are able to do what? To ascertain.
You're able to test the patient blood pressure.
Yes, it is measurable.
Measure.
Yes, it is measurable. Another practitioner can come to the patient and measure to get the same thing. And then the assessment at the end of all your subjective and objective data gathering, you will have a final assessment, or you could call it diagnosis, but for the sake of the acronym, it is A. And then P, the plan of action, would be, to do the test, investigation, give the treatment, and to recheck in 10 days. And like I said, you may see this acronym being used in other spaces. The E might be at the end of it, where they utilize the evaluation, right, which is what they had at the end of the plan here. So it's called SOAP. And you see another example. Moving on, slide. So using medical terminology, interactions are listed in chronological order. So when you go into the hospital, the patient's documents are listed in chronological order, and that means, can anybody say what chronological is? Anybody knows what that term means?
It means time sequence. When it happened, right. date and the time.
Right. So what is first is first. What is second is documented second. What is last is documented last. And also, they don't leave any space. No space is left, and that is for legal issues, legal reasons. Because if spaces are left in between patients' documents, people can insert information. Also, what you may find in the institutions is that they may draw a line, like you see after where it says the second line, where it's on the 10th of the 10th of the 1st, where you have MD, they would draw a line so that there is no space after a statement is written. And if anybody inserts something, because these are considered legal documents, and sometimes after 10 years, a patient's file may be pulled, and it is taken for legal scrutiny, and practitioners can be called into question. Okay? All right. So next slide, apply your knowledge. Which of the following statements is correct regarding deviation of medical terms? But the answer is there. So the change in medical term has been drastic over the years. Find the other, we'll move on to the next slide. Oh, we have 1 minute to go. We don't have time to go to the next one. Okay, tell me something, class. Do you all like to have a quiz each class? Would you like to have a quiz each class, or you think that would be a little too much pressure? What are your thoughts?
What pressure?
Too much pressure?
Yes, please. Too much pressure.
Okay.
Helpful.
Right. All right. So I'm going to encourage you to read your notes, because your exams will come from these slides that I share. I will not introduce any new information to you. Okay? We will continue with this at the next class. So read your slides. Your exams will come from your slides. So I'm going to encourage you all and just establish the fact that there is an A in this course for everybody. Every student has an A beside your name. That A will only change depending on what you do. If you come to class, if you engage, if you do your exams, okay? So I look forward to all the A's in my course.
Thank you, Dr. Donette.
Definitely.
Really appreciate you. Thank you so much.
Thank you so much.
Okay, I look forward to seeing you next week. Have a blessed weekend and enjoy the rest of your
Okay, well done. All the best, everyone.
Thank you, Dr.
Bye bye.
Bye.
Thank you.
Bye.
Bye. Bye, everybody.
Bye, everyone.
Tomorrow.
Good night.
See you tomorrow again. Bye.